Today we will be doing an NG tube on IV and also administering an IV fluids. I have all of my materials here in my pen and I will be setting up on my bedside table. And everything is sealed and closed and has not been open prior to me entering IV's room. Knock, knock, knock. Knock, knock. Okay. Good morning, Ivy. My name is Marsha Hicks. I will be your nurse today. We're going to be doing the NG tube and administering you some new IV fluids. Is it okay if I set up beside you here?
Yeah, of course.
Okay. I have my cup for my water. I have my syringe for my GI secretions, my lubricant for my pH strips. And I'm going to set this to the side. Good morning, Ivy. So today we're going to be doing you an NG tube. We're going to set everything up. Can you please reiterate your name and date of birth for me?
Ivy Armstrong, March 9th, 1964.
Do you have any allergies we need to be worried about today?
Just latex.
Okay. I'm going to set the bed up for you at a 90-degree angle just so you're comfortable doing insertion. Now I'm going to lift your head up just a little bit, okay?
Okay.
I'm also going to remove your pillow for a second. And set this aside. So to start, I'm going to be asking you a couple questions, and you can answer those to your best ability. So, can you please again reiterate your name and date of birth?
Ivy Armstrong, March 9th, 1964.
And where are you currently?
I am at the hospital.
Do you know the date and time?
It's February 2025.
And what about the procedure we're going to be doing today?
NG tube insertion.
Okay. Now that we have that, I'm going to assess your nasal, mouth, and stomach before we start. I'm going to pull out my light. And I'm going to be looking through your nose. Everything looks good there. Next, I'm going to be taking my mouth swab. And I'm going to check your gag reflex and just assess for any loose teeth or any breakouts or bumps inside your mouth. Everything looks fine. Okay, now we're going to check your gag reflex. Okay, this one as well. Now I'm going to put aside my light and discard of my tongue blade, if that's okay with you. Next, I'm going to pull your cover down and expose your abdomen. Is that okay?
Yes.
Okay. This is only going to take a few seconds. And I left my stethoscope, so I'm going to act like I'm listening to her lower quadrant, lower right, upper right, lower left, upper left, and then lower left. Sounds a little abnormal. So we're going to insert your GI tube and we're going to take the pH of that. And then there, how's that sound?
Good.
Okay. The first step I want to do is put the pad under you just in case we have any liquid slips. Next, I'm going to pull out my NG tube. First, I'm going to have you do a few things before we insert the tube, okay?
Okay.
I'm going to ask you to give me a good cough first. Okay. And next, I'm going to ask you to hold one nostril and blow, and then hold the other and blow, and tell me which was more comfortable for you. And that's the nose we're going to use for your tube.
Okay. My right side's better.
Okay. So we're going to use the right side to insert your tube. First, I'm going to lubricate just so it takes a little easier to go down. But before I do that, I'm going to measure from your ear to your nose and then to your xiphoid process. And then I'm going to go down just a little bit more just so we know that it's right there in your stomach. Next, I'm going to tape down where my NG tube will stop. This tape is a little old, so now that I have my tape, I'm going to mark off where my tube is going to be inserted. Okay, and now that I have that marked off, I'm going to get my lubricant and I'm going to spray down. Now that we have that, I'm going to insert into IV's right, about 10 inches, up and down. And then I'm going to grab my light and I'm going to check for the tube back in her throat. Say ah for me, Ivy. Okay. Now that I see the tube in the back of Ivy's throat, I'm going to set down my light. And I'm going to have Ivy. I'm going to have my other nurse come in, Felicia, to assist me while I put in. And Ivy take a couple sips, and I'm going to push down. Next, we're going to put our tube and connect that to our nose. And connect that to our nose and our ear. And then the tape isn't sticking, so we're going to act like this is connected to our nose. And then next, I'm going to pull out my tube, and I'm going to take out some of my GI fluids, about 20 milliliters, cc's, about 20 cc's, 20 to 30 cc's. And then I'm going to plug that back so we don't have any leakage. Next, I'm going to get my fluids, and I'm going to take a strip of my pH strips, and I'm going to open it back up, and I'm going to collect a few drops, and we're going to wait for the pH. We're supposed to be between 4 or higher, and our pH is right there at 4, so that's good. Now I'm going to discard of my pH strips. And the last step we're going to have to do is hook up IV to our suction and turn our suction on level 1, the lowest level. Okay, Ivy, I'm going to turn this on for intermediate. Okay, after we do suction, it was between that 20, 30, Now I'm going to turn that off, and I'm going to take this from IV and insert this. Now that we're done with that, Ivy, I'm going to clean you up. And I'm going to lay you back down at a 45-degree angle. I'm going to discard of this. Then for your IV, I'm going to go to the other side of the bed. We're going to do that way. I'm going to set this here first, and then I'm going to let you lay back just a little bit. And I'm going to set your pillow back behind you. Next, I'm going to finish your IV and get you some new fluids. So today, first thing I'm gonna do is make sure I have all my materials. I have my IV bag, I have my drip line, I have my saline solution to flush before inserting my IV, and I have my alcohol prep pads to scrub my hook. First, I'm going to open this. And I'm going to discard of the packages. Then I'm going to open my IVs. And after I open my IV, I'm going to take off my cap and take off my blue cap from my solution. And I'm going to prime that inside. And after, I'm going to hang this up. Once I hang that up, I'm going to enter some solution in my, and once that's through, I'm going to strike my IV. And the first thing we are going to do is unlock should see the start to come through. Now I'm going to lock that back and make sure that my cap is